Complementary feeding is nothing but weaning when we introduce non-milk foods in the diet. The World Health Organization recommends 6 months of exclusive breastfeeding. So you start weaning by 6 months of age in most of the situations. The ESPGAN has suggested not before completing 4 months, but not later than 6 months. This is because the baby may start refusing if you leave it too late. We can consider introducing after 4 months if the infant shows signs of readiness, but we can start in small quantities in addition to the full breastfeeds. So you discuss this with the family. Many parents have their own views on when to start it. So this advice of 4 to 6 months range, depending on when the baby is ready, and going in a slow manner is a reasonable advice. This is more applicable in the developed countries. In the developing countries, we have to weigh the disadvantages of contamination of food, risk of infections being introduced, and so on as well. And remember that cost-wise, breast milk is the cheapest, and so continuing exclusively breastfeeding till 6 months is going to be cost-effective as well. If you're starting prior to 4 months, the baby is not ready, both from the swallowing point of view as well as a gut readiness point of view. We have a higher chance of allergy as well as a higher risk of obesity in formula-fed babies. So before 4 months is a no-no. If you're starting after 6 months, there is a risk of iron and zinc deficiency, and the baby may get more fussy, and there's a risk of rejection as well. When we assess readiness, we have to look at the head control, and the baby should be able to sit with support. We don't need to be sitting without support. Sitting on a high chair where the front is supported and the baby can lean back with a cushion is a good idea. There should be shorter intervals between the feeding. The baby is hungrier and is looking for more food. The baby should open the mouth when presented with food, which indicates an interest in feeding. The baby is looking at the parents and very keen to eat as well. So if the baby demonstrates cues that they finished feeding, such as turning the head away from the breast or bottle when they are done, they are more ready to take solids as well. What to introduce depends a lot on cultural factors. First, offer a variety of single ingredient fruits, vegetables, grains, and meat in any order to allow for the baby to get accustomed. We don't recommend anything sweet. Honey should not be used at all in the first year of life because of the risk of infant botulism. There should not be any sweetened beverages introduced. Juices are not essential, and juices are nothing but fruit sugar. They are not good for the developing teeth, and they don't have any fiber or protein content unless they are with the pulp as well. So if you are giving juices with pulp, it's fine. If not, give fresh fruits directly. Some juices can be used where there is constipation, like apple juice or prune juice, for a brief period of time, but clean the gum area when you give anything sweet. Parents have to be clearly told that sugar means anything sweet, no jaggery, no brown sugar, no sweeteners. Avoid excess of rice-based weaning. Give a mix of oats, wheat, and other grains. This is mainly because of the arsenic load in the rice. Avoid excess gluten load. Introduce wheat after 6 months and in a reduced quantity if possible to avoid gluten sensitization. In terms of introducing allergenic foods, with current evidence, there is no benefit that introducing in a delayed fashion of the allergenic foods has any help. It can be introduced in culturally appropriate fashion any time after 4 to 6 months after non-allergenic foods are tolerated. The LEAP study, which was published recently, showed that infants at high risk of allergy, introducing peanuts in an age-appropriate form like paste between 4 and 6 months showed a lower risk of allergy developing. It's about a 25% reduction in the risk of allergy in these babies compared to controls. Evidence similar to the above for other potentially allergenic food like egg, fish as well. Introduce eggs in a cooked form, and remember that there is a risk of salmonella infection from uncooked egg, even if partially uncooked. And introduce fish one species at a time. And if there is other seafoods as well, you have to be careful when you introduce them.